Welcome to the Deep Dive, where we tear through stacks of technical reports, complex research, you name it, and pull out the really actionable, surprising knowledge, just for you. Today, we are wading into a topic that, well, it's guaranteed to interrupt sleep, cause distress, and maybe send even confident new parents spiraling a bit.
Oh.
We're talking diaper rash. Clinically, it's called diaper dermatitis.
Yeah.
Basically an inflammatory skin condition affecting, the whole diaper zone.
Yeah, it sounds very technical, diaper dermatitis, but the numbers here they're pretty overwhelming. This isn't some rare thing. It's actually the single most common skin disorder among young infants.
Wow, really?
The most common.
Yeah. We're talking a huge chunk of the baby population. It affects somewhere between, say, 7 and 35% of babies. It's a big range, but significant.
And it doesn't just happen like right after birth, does it? There's a peak time.
No, exactly. While it can happen anytime, it really peaks most frequently between 9 and 12 months old.
Okay, why then? Well, think about it. That's typically when they're starting to sit up more, they're becoming mobile, crawling maybe. So friction increases. Plus, parents are often starting that transition to solid foods around then.
Oh,
And that dramatically changes the chemistry of the stool, the consistency, the acidity.
that makes sense. Okay, so that sets the stage perfectly. Our mission today, cut through the confusion, unpack the real, multifaceted causes, because treating it right means understanding why it started.
Exactly.
And we want to give you clear, memorable steps for prevention and hopefully rapid healing. Okay, let's unpack this. For anyone listening who's dealing with this right now, what does it actually look like? And I mean, how painful is it for the baby? Can we tell?
Sure. Visually, the standard picture is pretty clear. Redness, some swelling, the skin looks tender, maybe peeling or chafed, all in the areas covered by the diaper, of course.
And the pain.
Oh, yes, it is painful. That's really important to acknowledge. You'll notice babies with diaper rash are often notably fussy, very irritable. They might cry out during diaper changes. And sleep can be disrupted, too, because shifting position can cause discomfort.
Okay, so when does it cross the line? From a common irritation to something needing, like immediate escalation. What are the serious signs?
Right, the red flags. These usually point towards deeper tissue damage or maybe a secondary infection setting in. You need to watch for blisters, any open sores, or pus-filled lesions.
Okay, blisters, sores, pus, definitely call someone.
Absolutely. Get professional attention right away for those. Less dramatic, but still notable, is warmth to the touch. That just signals intense inflammation, more blood flow.
Right.
And also keep an eye out for small red nodules or pimple-like bumps within the rash area. That's something called folliculitis.
Folliculitis.
Yeah, it's just inflammation of the hair follicles. But seeing that often suggests a bacterial element has kind of joined the party.
This seems critical, especially for our listener trying to figure this out.
Yeah.
How do we tell the difference between just simple irritation and, say, a fungal thing, like yeast?
Location. Location is pretty much everything here. A true irritation rash, the kind from just friction and wetness, it sticks to the main surfaces, buttocks, thighs, genitals.
Okay.
But crucially, it typically spares the skin folds, those deep creases where the legs meet the body.
Right, the creases. So what if it doesn't spare the folds? What if it's right in there?
Well, then you are almost certainly dealing with a secondary infection. And yeast, or candida, is the most common culprit by far.
Why the folds?
Yeast just loves those dark, moist, warm, protected creases. It thrives there. A yeast rash often looks different, too, maybe shinier, or really bright, angry red, and it tends to have what we call satellite lesions.
Satellite lesions.
Yeah, like little dots or spots of redness spreading out from the main infected area.
That's actually a really useful diagnostic clue where the rash is as important as where it is. How does this differ from other baby rashes, like eczema?
Good question. If you're seeing eczema or atopic dermatitis, that usually shows up away from the diaper zone. Think face, arms, legs. And it's typically linked with chronic itchiness.
Okay. Then there's seborrheic dermatitis. That's the greasy, yellow, scaly patches you often see on the scalp, like cradle cap. So if you see bright red, maybe peeling skin only under the diaper, irritation or yeast is your starting point.
Okay, let's get to the real core of it. It often gets simplified, doesn't it? Just change the diaper more often. But the research shows multiple kind of complex triggers working together to break down that skin barrier, Prolonged moisture is number one, yeah.
Absolutely, moisture is the main villain.
But what are the other key players?
Well, number 2 is friction and rubbing. This is a big one. Even if the diaper isn't soaked, if it's too tight or the baby's moving around a lot, picture that 9-month-old who's crawling everywhere.
That constant chafing physically breaks down the skin's protective barrier. It just wears it away, letting irritants seep in much more easily. Then factor 3 is often misunderstood, chemical or allergic reactions. And this isn't just, a reaction to the diaper material itself, though that can happen. It could also be sensitivities to creams, lotions, even laundry detergents used on cloth diapers or soaps.
Okay, chemicals. And the fourth one, which I found really surprising reading through this, is changes in the baby's internal chemistry, specifically diet.
Oh, absolutely. Diet changes are huge potential irritants. When you introduce solid foods, it changes everything. The consistency of the stool, how often they go, and critically, the acidity of the stool.
Or acidic.
Yes, more acidic stool is way more caustic, more damaging to that delicate baby skin. This is also why sometimes switching from breast milk to formula can trigger a rash. Different composition.
Okay, so we've got moisture, friction, chemicals, internal acidity from diet.
Yeah.
That brings us to the fifth culprit, which feels maybe the most sneaky medication.
Well, that's right. Antibiotics. It doesn't matter if the baby is taking them directly or if a breastfeeding mother is taking them. Antibiotics, well, they disrupt the normal, healthy balance of the skin flora, the good bacteria.
And that creates an opening.
Exactly. It basically promotes that opportunistic yeast growth we talked about. Antibiotics clear out the beneficial bacteria that normally keep yeast in check, leaving a vacuum for the fungus to just move in and take over.
Wow, okay. I never would have thought that the chemistry of the baby wipe itself was maybe more important than just, say, the ingredient list. The source material was really specific about pH balance.
It's a core insight, really. Healthy skin has a natural protective layer called the acid mantle, and it's slightly acidic. Its pH hovers around 5.5.
Okay.
Now, many cleansing products, especially some wipes or harsh soaps, have a higher, more alkaline pH, and using those disrupt this natural acidity.
What happens then?
When the skin's pH goes up, becomes more alkaline, it actually encourages the growth of harmful bacteria and makes the skin much more vulnerable to irritation and breakdown. It weakens its defenses.
So let's say a parent doesn't have a special low pH cleanser handy. Is plain old warm water actually better than using an average, maybe chemically harsher baby wipe?
Generally, yes, especially during an active rash. Simple warm water and a soft cloth is kind of the gold standard for cleaning. It's the gentlest option. If you are using wipes, you absolutely need to look for keywords: mild, fragrance-free, alcohol-free. And ideally, yes, pH balance to maintain that lower pH around 5.5 to support the skin's own protective mechanism.
That is a super actionable takeaway. Okay, let's switch gears to the practical stuff, the routine. The goal, like you said, is dryness, minimal friction, and maximum protection, like armor. Let's start with the basics. Frequency of changes.
Frequency is key, absolutely fundamental. During a rash, or even just in prevention mode if a baby is prone, you have to change that diaper consistently. Aim for every 2 to 3 hours.
Okay, even if it feels dry.
Even if it feels dry. And immediately after any bowel movement. No exceptions. Minimizing the time the skin is in contact with urine and stool, those irritants, is the absolute foundation.
Okay, step 1, change often. Next up, applying the armor. Let's talk barrier creams. Why is zinc oxide often highlighted over simpler things like, say, petroleum jelly?
Right. The barrier cream is your heavy artillery here. We recommend ointments with zinc oxide or petroleum jelly, but zinc oxide often gets the nod. Why? Well, petroleum jelly, like Vaseline, is purely occlusive. It forms a physical waterproof barrier, which is good.
Okay.
But zinc oxide does that too, plus it has astringent properties.
Astringent, meaning?
Meaning it helps to gently dry out weeping skin, and it actively promotes healing while also acting as that physical barrier. It's kind of a dual action. Products like Desitin, Balmex, A+D often feature zinc oxide prominently.
Okay, practical question here.
Yeah.
If I'm slathering on this really thick layer of zinc oxide paste, aren't I just going to cause more friction when I try to wipe it all off at the next change? How thick should it be?
Yeah.
And do I apply it every single time?
That's a fantastic practical point. And no, you don't wipe it all off. The general advice is to apply a really thick, visible white layer, like icing on a cake, so thick you can't see the skin underneath.
Okay, really thick.
Yes. Then, at the next diaper change, you gently wipe away only the soiled parts, the urine or stool, leaving the clean barrier cream intact. Then you apply more cream right on top, building up the layer. This minimizes rubbing on the sensitive skin.
Ah, okay. Don't scrub it off. Just clean the mess and reapply over the top.
Exactly. And yes, apply it at every single change when there's a rash present or for prevention if needed.
Got it. Now, the step people might skip but shouldn't, airflow.
Oh, airflow is absolutely essential for healing. You must let the skin air dry properly after cleaning. You can gently pat it dry with a soft cloth, no rubbing. But ideally, you incorporate some diaper-free time.
Naked baby time.
Naked baby time, even just 15 minutes here and there on a towel spread out on the floor makes a huge difference. It drastically reduces moisture and lets the skin breathe and recover.
Okay, crucial. Before we talk about treatment escalation, let's cover the big don'ts. We need to be crystal clear about baby powder and cornstarch.
Yes, this is non-negotiable, really, for both safety and effectiveness. Avoid baby powder completely, talc-based or not.
Yeah.
The risk of the baby inhaling the fine particles and causing lung damage is just too significant. It's not worth it.
Okay, no baby powder. What about cornstarch? Sometimes people suggest that.
Cornstarch should also be avoided. It has the same inhalation risk, which is bad enough. But even worse, if there's a fungal element to the rash, like yeast, cornstarch is basically a carbohydrate. It can actually feed the fungus, making the yeast infection significantly worse, so it can backfire badly. Stick to creams only.
Understood. Creams only, no powders.
Mm-hmm.
Okay, let's talk timeline. If a parent diligently follows these home care steps, frequent changes, gentle cleaning, thick barrier cream, airtime, how quickly can they expect to see improvement?
For mild rashes, relief can come pretty quickly. With that kind of diligent home care, you should definitely see noticeable improvement, maybe even near healing within about 2 to 3 days.
And what should they really focus on in those first, say, 24 hours to kickstart that healing?
Hit it hard and fast. Immediate changes, absolutely no delay, maximum possible diaper-free time. Use only warm water for cleaning, gently pat dry. And then apply that thick, moisture-absorbing barrier cream, like the zinc oxide kind, generously. That intensive approach in the first day can make a big difference.
Okay. But what if the rash is stubborn or it looks really severe from the start? Then we move to medical help, right? What does that involve?
Right. If home care isn't cutting it, or you see those signs of secondary infection, like that bright, shiny red appearance, maybe with those satellite spots suggesting yeast, the doctor will likely prescribe a topical antifungal cream, something like miconazole or clotrimazole applied directly to the rash.
Okay, antifungals for yeast. What if it looks bacterial, like those follicles were inflamed?
If a bacterial infection is suspected, based on the appearance, or maybe if there are open sores, a physician might prescribe oral antibiotics, or sometimes a topical antibiotic cream.
And for just really bad inflammation?
If it's just intensely inflamed, very red and uncomfortable, but maybe not clearly infected, a doctor might advise using a very mild hydrocortisone cream, like Diaper 0.5% or 1% for a short time, just to calm the inflammation down quickly and help the skin heal. But that's usually under guidance.
Right. Okay, this leads to the big question. When do you stop trying home care and actually call the doctor? We need some clear rules of thumb here.
Absolutely. Clear guidelines are important.
Give us the scenarios. When is it time to make that call?
Okay, first, if the rash appears on a newborn, especially a baby under, say, 6 weeks old, call immediately. Their immune systems and skin barriers are just too immature for you to manage it alone.
Newborns, call right away. Got it.
Second, if you've been really diligent with the home care routine for 2 to 3 days and the rash is either not getting any better or worse, it's actually worsening time to call.
2 to 3 days, no improvement or getting worse.
Okay. Third, if you see any of those signs of complications we mentioned earlier, bleeding, blisters, or any pus-filled sores, a few tiny pimple-like bumps might be okay, but any actual break in the skin needs evaluation.
Bleeding, blisters, pus.
Check. Fourth, if the baby develops a fever along with the rash, that could indicate a more systemic issue going on.
Fever's a flag.
And finally, fifth, if the rash spreads significantly beyond the actual diaper area, if you start seeing it on the arms, the face, the scalp, that suggests it might not be simple diaper dermatitis and needs a proper diagnosis.
Okay, that's a very clear set of rules. Thanks. This has been incredibly insightful. I feel like we've really unpacked the complex causes, moving beyond just moisture to friction, pH, antibiotics, diet changes, huge factors.
Yeah.
And we also have those clear, actionable steps for prevention and for healing.
And remember the core principles, right? Maximum dryness, minimum friction, and applying that strong protective healing barrier. Using products maybe with zinc oxide for that dual action we talked about, It's about applying the knowledge.
Yeah, and to give you that quick takeaway, skincare for babies is surprisingly complex, but you can manage it effectively if you remember these key things.
Hmm.
The pH of your wipe might matter more than its scent.
Mm-hmm.
Powders like cornstarch can actually feed a fungal infection, which is counterintuitive.
Right.
And something internal like a change in diet, introducing solids, can be the actual trigger point for that skin irritation. So before we wrap up, since we've established that chemical balance and friction are these major accomplices helping moisture break down the skin barrier, let's leave you with this final thought to chew on. Given how incredibly sensitive newborn skin is, what other common household products, maybe think about strong laundry detergents used on baby clothes, or perhaps heavily perfumed fabric softeners, what else might be silently disrupting the skin's natural, slightly acidic microbiome, even when the product isn't applied directly in the diaper area? That kind of systemic effect of everyday chemicals. That seems worth exploring further, doesn't it?
Definitely something to consider.
That's all the time we have for this deep dive. We really hope you feel thoroughly informed and ready to put this knowledge into practice. We'll see you next time.